Welcome to Cape Town, South Africa, the home of Table Mountain, one of the new 7 wonders of the natural world. But only a few kilometers away lies Xhalisa, a township like many in the developing world, where poverty, crime and illness are rife. And yet one of its most insider secrets has long gone unnoticed: the mental health of its hundreds of thousands of inhabitants. Professor Crick Lund of the University of Cape Town is the director of the Center for Public Mental Health. He attributes the lack of treatment of mental health disorders to a gap in mental health care in Africa.
There is a growing burden of disease attributable to mental health. However, if you look at the resources that are allocated to this, only around 25% or less of people who have a diagnosable mental health problem are receiving any form of evidence-based treatment or care. And that's what's referred to as the treatment gap.
The Ellen J. Fletcher Center for Public Mental Health is looking to set right what has long been overlooked. Professor Leslie Swartz of Stellenbosch University is a co-founder of the center.
Here at our department at Stellenbosch University, we became increasingly interested in the issue of public mental health issues for Africa. And a similar process was happening at the Department of Psychiatry and Mental Health at UCT. The minute we heard that, we decided that the most sensible thing to do was to pool our complementary resources and to create one center.
The Center for Public Mental Health has identified the lack of access to mental health care as a major obstacle in overcoming this gap.
There's around 1 psychiatrist for every 2 million people in Africa, around 1 psychologist for every 2.5 million people. So if we were to try and meet the mental health needs of the African populations, the queue would stretch from Cape Town to Cairo.
The center has been working closely with ministries of health, including South Africa, to bring attention to the mental health crisis in Africa and developing countries.
Mental health is one of the key priorities of the Department of Health for various reasons. First and foremost, it's not unique to our country. And what we've also realized with all the interventions that we have made, the uptake of mental health services, especially at the primary level, is still very, very low.
Thabisa is one of many depressed women who has received care at the hands of mental health workers in Cape Town. She feels that understanding depression is the first step in improving mental health care.
It's been very difficult, especially like being alone, because the thing is that with depression, it doesn't tell you when it comes. It just comes unexpectedly, and it's more like a disrespectful visitor who just comes uninvited.
Richard Ergunst is one of many mental health service users frustrated by a lack of adequate health care in South Africa. He suffered from severe obsessive-compulsive disorder and is now in the first stages of recovery.
It took me about 4 years to find the appropriate medical doctor to treat me with appropriate medication. And I really worry about people that are living out in the poorer suburbs where they don't have access and in terms of time and money and facilities.
The center is trying to develop innovative ways of meeting the treatment gap, particularly in vulnerable communities.
So we are, for example, conducting a randomized control trial right here in Xhalisa, in which we are evaluating the outcomes of an intervention delivered by community health workers for mothers during the perinatal period.
Putting the research of the center to work is a mental health counselor, Nyatsanza.
My role is that of a mental health counselor. There are a lot of women in low resource settings or in the townships who are unable to receive treatment, and it serves the purpose of filling the gap that's there in terms of treatment for depressed pregnant women.
Richard also feels that community intervention can prevent the need for hospitalization in many cases.
I think the community level is the way to go in terms of intervention and health promotion and disease prevention, where you look at the person before they get the illness as opposed to once they've got the illness.
The suggestion that I would make for researchers and policymakers would be to get more information from the depressed women, because their stories provide a better context for depression, and these women can actually serve as mentors to other depressed women.
I think the best way to improve research within the mental health care in South Africa is to go to these communities, like interview people and also educate them. For instance, my uncle thought that probably some of my neighbors were bewitching me because I'm the first person in their community to go to university, whereas I knew that it had nothing to do with witchcraft.
The Center for Public Mental Health is working hard to overcome preconceptions in ways that are suited to these communities.
People living with what might be a diagnosable disorder of schizophrenia understood their condition as amafufunyana, which broadly translates into spirit possession. Most of those people had come to find that a combination of antipsychotic medication with traditional healers had really helped them to learn and live with their condition.
But the center itself is not enough to effect the changes necessary to improve the mental health services in Africa. The center is working closely with the Department of Health to better translate research into policy and practice.
So one of the most challenging tasks we face as the Centre for Public Mental Health is trying to get mental health onto the health and development agenda when there's so many other competing priorities. The massive HIV epidemic, TB, malaria, maternal and child health. And what is interesting, for example, we know that simply providing an antidepressant medication can increase not only adherence to antiretroviral medication for HIV, but in fact improve CD4 count. So the slogan, "No health without mental health," is a slogan with substance.
Evidence-based medicine is very important for us. We have invited experts in our country, and Professor Lund is one of them, to work with us in reviewing the progress we've made in terms of strengthening mental health services, looking at policy gaps, and looking at also at translational research.
We currently run a master's program in public mental health, and we teach students who come from a range of different African countries. They come to a short course on research methodology and then return to their countries to conduct their research under supervision.
Public mental health is a very wonderful program for me. It has given me a very broader view of mental health issues, particularly in our country.
You have to look at the treatment of individuals, not only individuals but the whole entire population. So there is a lot of work there. And then rehabilitation of these people within a community. And there is also advocacy, collaboration and networking.
Mental health in general is something that is not spoken about much in terms of healthcare, and it receives a very tiny amount of the budget. So I think that this kind of training will boost my personal capacity and help me to be able to advocate for better services, help me to be able to advocate for research, that needs to be done.
The mental health situation in Ethiopia is that the population is over 80 million, and there are only about 44 psychiatrists.
So the training in research is going to help me be a better advocate for changes in policy and in services.
There's so many people suffering from mental illnesses, but we don't know the prevalence or the incidence, or even, how many out there have these particular disorders. And I'm grateful I'm on this course because I think it has exposed me to how to collect this information, and of course I'm sure it will expose me to how to publish it.
It has given me a broader view of mental health issues, and which will have a bearing both to my career advancement and my programming when I'm back in my country.
Not only Ethiopia but other countries in the Horn of Africa I think would benefit from my training here, because we treat other peoples also, and we also do help in terms of research.
We are very excited that experts do not only look at their own publications, but they also look at strengthening institutions for public interest.
Alan Fletcher was really a visionary in terms of mental health in Africa. So it's a terrible tragedy that he passed away, and an enormous responsibility for us actually. It's very big shoes to fill, but I feel very privileged to have known and to have worked with Alan, who's did so much for mental health in Africa and, in fact, further afield as well.
The Centre for Public Mental Health has grown enormously in the last 2 years, and we've been very fortunate to secure grants from the National Institute of Mental Health in the USA, from the Department for International Development in the UK, from the EU FP7 framework, and we are now in a very good position to continue developing this work in the years ahead. We are looking for ways of sustaining our work, and for that we need commitments from universities and from philanthropic organisations.